Hi, I'm Dr. Michael L. Johnson. It's 2012. We're starting a new video series. Today, we're going to talk about equipment. What is it with chiropractors thinking that the more equipment they have, the more successful they're going to be? The last thing that you should do is spend money on equipment this year. I mean, my basement is full of things that I have used, and I've been in practice 29 years, that I thought I had to have. And you know what? It's sitting in my basement or it's upstairs. It's crazy. Do not buy any more equipment. Take that money, put it into marketing. Get people into your office. Marketing to me is an investment, and I'm going to do a whole other series on marketing. But do not spend any more money on equipment. My rule is $500, the $500 to $1,000 rule. If it's under $500 or $1,000, okay, maybe. If it's over $1,000, forget it. I mean, there is some crazy stuff. I have a $24,000 laser. Did I need a $24,000 laser? No. A $3,000 or $4,000 or $5,000 laser would have been fine. Chiropractors out there were paying $100,000 to $125,000 for a spinal decompression machine because it's true spinal decompression. I could never see the logic in that. You know, I just got a low-end Chattanooga. I got 5 of them. Paid $6,000 a piece. They work great. I combine it with exercise with oxygen therapy, and I combine it with oxygen. And if you can do that in your state, great. But if you can't, don't worry about it. Address them metabolically. You've got to decrease inflammation in the patient system. For those of you who are doing decompression, and you have patients that aren't responding, and you know that's true, part of the reason is you're not decreasing their inflammation. Patients have to be handled metabolically and neurologically. It's not one or the other. You see? What is it with chiropractors? The more stuff I have, the more successful I'll be. That's the mindset. That's the headspace. And again, I'm going to do a whole section on headspace in the future. Because what between the chiropractors here, so many chiropractors out there think that their care, that they should accept an extremely low fee because that's all they're worth. Their self-esteem is so low. When literally you can change people's lives addressing them metabolically and neurologically. Get people better, nobody else can get better, and you deserve a professional income. I have always said that since I started my program. So, you can join our group, the Neurometabolic Supergroup, for as little as $144 a month. We offer a complete money-back guarantee. I will tell you, nobody else out there with any other program in chiropractic is offering you a complete money-back guarantee. What's the stipulation? You have to return it within 6 months. You can't return it in 18 months or 24 months and think you're going to get your money back. I've had a couple of people try to do that on me. That's not going to happen. You return it at 3 months or 4 months or 5 months, you get your money back. So for $144 a month, you can affect the lives of thousands of patients in a positive way. Be paid a professional fee, and be the true healer that you were meant to be. What's your passion? What's your focus? What's your intensity level? I'll tell you one thing, it's going to be a lot less if you just flood your office with more equipment. You don't need, even doctors coming in, and if you decide to join our program, the first thing I'll tell you, do not buy more equipment. Oh, but what about an interactive metronome? You don't need an interactive metronome. Okay? What about spinal decompression? You don't need spinal decompression right away. Although I will tell you a story. I had a doctor come into my practice. He wanted to do decompression. I said, fine, get a low-end table. He literally sold a care plan to a patient, ordered the table, had the patient wait till the table came in, and that's how he purchased his first table. I'm not saying you should do that. I'm just saying it's an example of thinking outside the box. The good news is this patient had suffered for years with back pain. He got him better. So the patient was happy, the doctors were happy, all of his future patients are happy. It's time to think outside the box. We have a powerful profession. We have a wonderful profession. You know, and it's only getting better. But it's getting better because we are literally changing people's lives. We're giving them the gold brick of health. We're addressing them metabolically and neurologically. You know, I would have all these patients come into my office, and when I was just, you know, I started out in chiropractic in 1983. Let's just go there. I started off at Gonstead. That didn't really seem to get the people better, because I'm always about getting people better. So I did some activator. I actually went to an activator seminar, and I had a severe migraine. And I came down and got adjusted, and the guy goes, "Wow, you're really not doing well." I'm like, "No, I'm not." He adjusted my right atlas with the activator. I went up to the room, I vomited. I felt like $1 million right after that. So I started doing activator. I still do activator to this day. I use an ArthroStim. I got into network spinal analysis. I got into TBM. I got in, you name it, there isn't a technique, chiropractic biophysics, Pettibon, that I haven't tried in 29 years. Because I'm on this quest to get people better. Nobody else can get better. To me, that's the measure of success. To me, this is the reason you are going to make a professional fee, and you should make a professional fee. They've been to 20 doctors. Nobody got them better. You get them better. Yes, the patient should pay me. I don't have an issue with that. And you should not either. So in 1997, I got into chiropractic neurology through the Carrick Institute, and that was amazing. I'm like, wow, this is phenomenal. And what turned me on to it was the very first module. Dr. Carrick has a chiropractor up there who had a stroke, and Dr. Carrick would show the guy a pencil, and the guy would go 99. Show him reflex hammer, 99. Everything was 99. How old are you? 99. What's the weather like today? 99. And Dr. Carrick told the treating doctor what should be done, and come back a month later. And a month later, the patient, the person, the doctor who had had a stroke, was speaking just like I'm speaking to you. That's what sold me on it. And it was great. But you know what? I would still have those patients that weren't responding. So in 2008, I went to an Apex Energetics seminar with Dr. Datis Karazian. Blew my mind. Amazing stuff. You've got to decrease inflammation. If the patient has any inflammation in their body, you've got to decrease it if you're going to get them better neurologically. That's the difference. If a patient has gut inflammation, their gut's inflamed, they've got parasites, yeast, fungi, mold, bacteria, and Cyrex does a test for it, array number 2, then they certainly have brain inflammation, and you're not going to make changes in the brain until you handle that gut. Well, you'll make some changes, but not as effectively until you handle them metabolically. So how can you not be passionate about this? How can you not have purpose in your life? How can you not be intense about getting people better? And if that's what you want, that's what I'm looking for. I want the top 10% of the profession, or the people out there, the doctors who want to be in the top 10% of the profession. That's what our board is about. That's what our program's about. That's what we do, period. So if you want that, like I said, go to txchronicpain.com, go into the site, you can download the free report. It tells you the different levels, level 1, 2, or 3. It tells you the pricing structure, and you can get in at level 1 for $144 a month. Try it, test drive it for 3 to 5 months. If it's not for you, send it back. I'll give you your money back. But I'm counting on the fact that the vast majority of you are out there and saying, I want something different. It's 2012, and I want to actually change people's lives. That's what I got into chiropractic for. That's what I want to do. So I'm Dr. Michael Johnson, and I look forward to seeing you in our neurometabolic supergroup. Thanks.